I don't think we can really look at the NHS now and say funding is the issue. I think what we need to do is, at a local level, we need to fully merge the social care and NHS systems. That is a big reform which I don't hear anything about from the government. The path to safer care is the same as the path to lower cost. That 10% of the costs in modern healthcare systems are hospitals putting right mistakes they've made. What we need in the NHS is a cultural change. There is too much top-down control, and we are forcing managers to follow bucket loads of targets. I think that we allowed the social care debates to become something about helping Middle England protect their inheritances. When we have artificial intelligence destroying lots and lots of jobs, we're going to once again have a system which makes a few people very, very rich and many other people insecure. So why doesn't Britain get out there and work out how do we tap into the massive benefits of technology and AI so that it's something we all benefit from?
Voices of Care, the healthcare podcast.
Welcome to this special episode of Voices of Care. We're not in our studios, we're actually in Westminster, opposite the Palace of Westminster, here at Portcullis House. And we have a special guest with us, the longest serving Health Secretary and also former Chancellor and Foreign Secretary to boot, the Right Honourable Sir Jeremy Hunt. Jeremy, thank you so much for making time and joining us for Voices of Care.
It's a great pleasure. Thank you for having me.
Well, thank you for making the facilities available here. I'm reminded as we kick off, it's a very seminal time for healthcare, but you're on record as saying that actually becoming a health secretary, one of the best advice for any minister is actually to find one thing that they want to concentrate on and change and focus on that. And when you rather unexpectedly were given the healthcare portfolio, you didn't have that one thing, but it was thrust upon you, which I think is the mid-staff, and patient care and patient safety has become a beacon that you've carried, I think, ever since.
Absolutely. And I arrived, it's one of the sort of curiosities of our democratic system, that we put generalists in charge of these really important ministries who have no prior experience. I had no background in the NHS. I'm not a doctor or a nurse or anything like that. And I thought, look, I've got the largest healthcare system in the world, fifth largest employer in the world, this enormous bureaucracy, and I better just find one thing. And it found me. And, literally within months, well, in fact, in my first week, I was given the first Robert Francis report on mid-staffs. And I was so horrified. There was such a disconnect between the values the NHS says it stands for and what was in this report. And then I started inquiring, and I think this is very relevant for the social care sector as well, about this phrase that kept on coming up, avoidable deaths. And I thought, what is an avoidable death? Yep. And it basically turns out to be a death that wouldn't have happened if someone was getting the care they should have been getting. And we were having, at the moment, the NHS has about 13,500 avoidable deaths.
150 a week.
Yes. And so I thought, why is it people don't talk about this? And it turns out not just in the UK, but all over the world, there is this kind of omerta amongst the medical communities that avoidable deaths are these things that sometimes just happen. And we don't really talk about them because it's very awkward, and it's not that medical professionals aren't trying their hardest, but we should talk about them, because unless we talk about them, we're not going to learn.
Absolutely. And you obviously took that as a signal to really focus on that one thing. And I just want to stay with that a bit and explain just how important that is, of course, from an emotional perspective, of course, from a human perspective, but also from a brass tacks perspective, because I think the all-party parliamentary group on patient safety, it's £14 billion of costs, is there something like that?
Yes, I mean, the OECD say that 10% of the costs in modern healthcare systems are hospitals putting right mistakes they made. So there's a huge cost, and this was the thing that I had not fully appreciated that it's not about more expensive care. It's actually about, one of the giants of the global patient safety movement is someone called Dr. Gary Kaplan, who for many years ran
Virginia Mason
in Seattle. And his famous saying is, the path to safer care is the same as the path to lower cost.
Absolutely. And one of the things that I was interested to learn, and we're going to obviously talk about contemporary fields, but I really want to pick up on some of the lessons from your longevity as Health Secretary. You were able to actually claim one of the, what you call it, one of those rare things in public policy, an actual program and policy that worked, because you made a commitment to reduce neonatal and early baby deaths.
Yes, and I think that, politicians are famous for statistics and damn lies, or whatever the phrase that Churchill said. But when I look back at, I was health secretary for nearly 6 years, and my main focus was patient safety. I wasn't a popular health secretary. I had a junior doctor's strike for nearly a year, and my name was mud throughout the NHS. But at the end of that time, the number of baby deaths, to use the phrase that most people would understand, had gone down by 15%, which is basically about 2 fewer deaths a day. And no one in the public has heard of that.
It's not a statistic that is as well known as it should be, because the benefits are incalculable for the families who would otherwise have had to deal with this trauma.
Yes, and I think of all the things I've done, that's the thing that I will be most proud of until the day I die.
Now, you said that actually becoming health secretary obviously changed your destiny and personal destiny. And I want to move fast forward to the 10-year health plan that was published back in July, seminal moment for the present government. And you're on record as saying that patient safety must be at the heart of this 10-year plan. Do you think that it is? Because there is some encouraging proposals within it regarding specifically patient safety.
I think there are some good things in the plan, and I wish we're treating well. I'm not a Labour supporter, but we've got a Labour government, and I really want them to turn things around in the NHS, which has never really got back on its feet after the pandemic. But if I have a worry, I think that the thrust of the 10-year plan is very tactical. But actually, what we need in the NHS is a cultural change. And what you have with the NHS is a system which, in some ways, there's a paradox. It has the most wonderful values of any healthcare system anywhere in the world. It was one of the first big systems to say it doesn't matter who you are, rich or poor, young or old, north or south, you should be able to access the healthcare you need, irrespective of your own personal bank balance. And that is a wonderful thing we can all be proud of in the UK. It was the 6th universal healthcare system in the world. Now nearly everyone has it. So that's a wonderful thing. But at its worst, the NHS turns people into numbers and statistics and doesn't treat them as human beings. And I think the reason for that is because there is too much top-down control, and we are forcing managers to follow bucket loads of targets.
100, I think, in one of the counts.
I think some of the hospitals have, but certainly it's probably got a little bit better, but it's certainly now hospitals, I think, have got between 20 and 40. GPs still have got about 50 or 60 targets that they're following through the QOF regime. And what that means is that they're always looking over their shoulders at their line managers in NHS England or the Department of Health, whereas in other countries they would be looking below them at the patients that they're responsible for and making that their primary responsibility. And I think, if anything, there's evidence that the Department of Health is trying to exert more central control. And I'm not sure they understand that the unintended consequence of this is that patients remain numbers and not human beings.
And that's a really important point, because the rhetoric around the 10-year plan is that patients will be at the centre. There's going to be a patient advocate. We're going to have the CQC more data-led and agile. And of course, the ratings of the CQC was something that you were very intimately involved in. But it seems like this one of the warnings in your book Zero, which came out after you, of course, left the office as Health Secretary, was, and I think the quote is that you said that the NHS was the most micromanaged health service in the world, but that warning doesn't seem to have reach the policymakers because we've got the league tables coming back. I'm reminded of Sir David Nicholson saying you can hit the target and miss the point.
And he spoke very wisely on this. And I think that, we need to be really careful because I think in the eyes of Labour politicians, they think the NHS was in a good state in the first decade. And then after 2010, it fell into disrepair. And
Dire reform, I think, is the language that's used.
And the truth is the NHS did get better in the first decade of this century, but some of the cultural problems led to things like mid-staffs. And I think it's really important we don't unlearn the lessons of mid-staffs, which is that if you have a system that is too centrally controlled, too focused on with managers thinking that unless they deliver this number by the end of this month, whether it's operational or financial, they're going to get fired.
Yes.
Then you end up with mid-staffs, Morecambe Bay, Shrewsbury and Telford.
And the list goes on.
The list goes on and on.
And it's interesting because I think that will come on to the blame culture, if I may, how we can reverse that. One of the other things I wanted to talk about, you mentioned that the government supporters would harken back to the Blair-Brown era of extra funding, etc. And I'd like to come to the F word, if I can, funding, and what is in this plan, because I found it striking in your book Zero that occasionally as a health secretary, in order to exert pressure for extra funding, you've sometimes had to go about it in unusual ways. It was an election year, but I think you had to pitch it to Mr. Osborne, who was then Chancellor, while he was having a haircut.
That's true. And I definitely came to the conclusion after 5 years in the job that the NHS needed more money. And I negotiated with Philip Hammond as Chancellor and Theresa May a £20.5 billion increase in the annual NHS budget, which is, nearly 1% of GDP. But I think we also have to recognise that today, out of 38 countries in the OECD, the advanced economies, the NHS actually gets the 5th highest funding of all of them as a percentage of GDP. So I don't think we can really look at the NHS now and say funding is the issue. I think that the model of care that we have, the really backwards IT systems, the inefficiency in all sorts of ways are something that have to be addressed. And I'd like to see more of that actually than we've seen so far from the government.
Well, we will wait to see, obviously, if the lacuna from the plan, which of course there was the chapter on delivery that wasn't there, and we'll see what that has to say. Just touching back onto patient safety very briefly, if I may. James Titcombe, who you'll know extremely well, a very passionate advocate for patient safety, particularly around maternity services, has been on record as saying the appointment of Baroness Amos to review maternity could be a genuine turning point. And I know maternity is really close to your heart. So just want to take a time to discuss that as we see so many investigations taking place, as you said, in Leeds, wherever you want to call it, Nottingham. This could be a turning point, he says. Do you agree?
I think it could be. And I'm really delighted at Valerie Amos's appointment. I'm going to see her shortly to talk about what she does. What I think we don't need is a whole new set of ideas, because we've had so many reports by Bill Kirkup and by Donna Ockenden, and they're very good. What we need to do is to take the recommendations that we've had and prioritise them and put a timetable to them.
And Penny Dash has effectively said that in her review.
Yes.
We need to garner these recommendations and implement.
Yes. And so I think it's a very useful exercise to take all these recommendations and to say, look, these are the ones that we're going to do in the next 12 months. Yep. These are the ones we're going to do in the next 3 years. This is the timetable. This is the plan. And then I am very hopeful that we will be able to turn the corner.
One final point, if I may, just carry on the patient experience, because that's at the heart of what the NHS should be. There is reference to, in your book, where you highlight I'm a former practicing lawyer, not in that field, but the pressures that are added to families when they try to get to the truth of matters. And this is the whole litigation and negligence process. You've asked for quite a lot of reform because actually it costs the government a huge amount of money.
Yes, I mean, we now spend more on settling claims for maternity lawsuits than the cost of every single doctor or maternity nurse or midwife in the NHS. And that is completely shocking. What we need to do is to move away from a blame culture to a learning culture where when a tragedy happens, we make it super easy for doctors and midwives to say exactly what happened and not to feel, which many do at the moment, that if they're honest about making a mistake, they'll be made a scapegoat and they'll lose their job. Yep. And that, I think, is what happens at the moment. And so as soon as you have a tragedy, a child born with disabilities, instead of trying to get honestly to the bottom of what happened, people clam up.
Yep.
And then the tragedy is the same thing happens a few weeks later somewhere else in the NHS.
And to make that cultural change, because culture is one of those, sometimes it's dismissed as a soft skill or word, but actually it's profoundly important. You've talked about Virginia Mason. Tell us a little bit about, because you spent a lot of time on this, how we inculcate that culture, because it has to reverse quite well-established defense mechanisms without disparaging the medical profession and hierarchies.
Well, if I talked about this in a sort of maybe language that's more familiar in the business world, which is where I came from, the Japanese have this concept of Kaizen, continuous improvement. And it's been proven to work from companies like Toyota to many other global companies. In fact, Virginia Mason in Seattle is modeled on Toyota and their manufacturing system. But you can only have continuous improvement if you create a positive work environment where people are able to talk honestly about what they're getting wrong and how they could do things better. And it's interesting that I talk about this in the context of patient safety.
Yep.
But exactly the same is the case if you want to improve the quality of care more generally. And indeed, it's the same if you want to improve productivity and reduce waste. And so I think that culture has been far too negative for far too long across healthcare systems all over the world, but definitely in the NHS. And I think that, one of the things that I would say to Wes Streeting is that when I became health secretary, if someone had said to me, do you want to change the culture in the NHS? I'd say, don't be ridiculous. That's far too nebulous. You're never going to change the culture in something as enormous as the NHS. By the end, I realized the only permanent change is cultural change. And I feel when it comes to patient safety, what I delivered was half a revolution, not a whole revolution. So I think what does happen now in the NHS that didn't happen before is people are honest about failings in care. When I arrived, even being honest about a care failure, you would get criticism for, inverted commas, undermining the NHS or undermining public confidence in the NHS. And indeed, the previous Labour government covered up what happened in mid-staffs for nearly 4 years, actually, in some ways, from a noble motive. They were worried that, it was going to undermine the NHS. I'm sure, I don't know if all the motives were noble, actually, but, the reality is you've got to be honest. So I think we've changed that bit of the NHS culture, but what we haven't done is made it easy to change things for the better and actually change working practices because people are still worried that if they're open about what they themselves did, they're going to get fired.
Well, obviously, I think it was at the NHS Providers Conference back in November 24, Mr. Streeting said bad managers are going to be sacked. So that's to your point. And it's interesting you talk about the power of confronting the realities. And I think it was when you had an epiphany, I think it was at Lady Margaret Thatcher's funeral, about actually seeing letters from patients, and you only shown at the beginning the positive letters. I think that's right. And actually you then tackled the bad letters. I think it's a question of encouraging people. There's a phrase I think you mentioned, even in the armed forces, I think the phrase was, even officers should be trained to disobey, if I've got that
Yes.
right.
Well, that was something my father always said. But when I arrived as health secretary, the establishment was designed to protect the health secretary from actually having contact with NHS patients. And we'd be getting in these letters, and I'd never see them. They'd never cross my desk. They'd be written to me, but they never crossed my desk. And they didn't want to show me the letters. And I said, no, I think it's really important that I do see the letters. And I would read them, and they were heartbreaking. Sometimes I would invite in patients and their families to meet me. And sometimes I would invite in the hospital that they were complaining about. And what so many of them said was that when they had a tragedy like, a wonderful couple from Devon who lost their 3-year-old son to sepsis, they said when they tried to complain to the hospital, the shutters came down. No one wanted to talk to them. No one wanted to meet them. And that, of course, is where the NHS culture is still wrong. And I think we are better than we were. And that was why it's so important that the CQC is able to be completely honest in its inspection results and say that the care in this organisation is failing, and be absolutely black and white about it. Because only when you are honest about the problem do you then create the momentum for a solution.
Yeah, and I think that, just a final point on this, I think it's David Marks, the thinker, who came up with a just culture, the difference between human error and reckless error, and the power to embrace change and actually encourage people to have the safety to speak up.
Exactly. And we can look at the industry that's most often talked about as having succeeded in doing this is the airline industry. And, there's a world of difference between an error that a pilot makes because they get distracted when they're doing check number 15 of 25 pre-takeoff checks, and a pilot turning up to fly a plane drunk. Now, in the latter case, there should be no quarter. They should be fired. That's totally irresponsible. But in the former case, missing out a check because they were distracted, well, then maybe we should ask why, and whether we can redesign systems so that that doesn't happen to other pilots. And the airline industry has had a very good record over the last 25 years. Actually, been very unfortunate in the last 6 months, but over the last 25 years,
massive reductions.
Been a massive reduction. In fact, I think in 2017 there were
zero
casualties across the entire world for commercial flights. So that, I think, is the ideal. That's why I called my book Zero. Can we get to zero avoidable deaths in healthcare? Well, maybe we can't, but we should try.
It's an aspiration, absolutely. One final point on the culture point. Obviously, the NHS is its people. I think you said that if there was one thing that you wish you had known when you began as Health Secretary, was the importance of workforce planning. And I just wanted to touch, whatever the aspirations of the 10-year health plan, Mr. Streeting, etc., has, he will have to take the workforce with him. One of those issues will be to try to avoid disputes. You've talked about, of course, you became famous, even infamous, in terms of the junior doctor, resident doctors now strike. Just want to see if there's some advice you might give, because you took a very bold step, I think, reaching out to some of your critics. I think Rachel Clark might have been one of them, and trying to learn, with the benefit of hindsight, how you could have played it differently, because sometimes communication can submerge the substantive issues or lead them to misunderstanding.
Yes, I certainly didn't get everything right in the junior doctors' strike, although in the end I did win, and my contract still stands. Actually, it's still the contract the junior doctors use today. But in retrospect, I wish that I'd had the battle with consultants rather than junior doctors, because actually it's consultants that can make the biggest difference to patients in terms of weekend care, and it's really more consultants that we need in hospitals at weekends. So that is a regret that I have. But I think what I would say to Wes Streeting is that he may have thought that the reason there were so many strikes in the NHS is because it was the hopeless, evil Tories who are running the government. But there are, inside some of the health unions, particularly the BMA, some very politically motivated people. And in the end, you have to make a very clear judgment as to when you are going to take a stand and when you're going to compromise. And I think with the benefit of hindsight, giving every union everything they wanted on their entire shopping list within weeks of coming to office actually probably laid the foundations for more industrial disputes at a later date. And so I do think you should have a constructive relationship with the workforce. But the problem that Wes Streeting has is that the NHS budget, as agreed in the spending review, is actually going up by less than it was planned to go up after the last 10-year plan that was agreed at the end of 2019. And so if he doesn't have discipline on pay awards, there will be no money for extra treatments to bring down waiting lists, for digital transformation of the service and moving upstream to prevention rather than cure. All those things will be absorbed in higher pay. And so it's a very, very difficult thing. It's perhaps the most difficult thing that he has to wrestle with, although it's not the thing the public talk about. But he really does need to show discipline. And I think that with the benefit of hindsight, probably what happened in the first months of the Parliament was unwise.
Hopefully he's listening and taking heed. Before we talk about the future, because obviously you've had your new book published, which I'm keen to speak about briefly, particularly its health-related aspects, I just wanted to touch upon social care. You call it unfinished business in your book, Zero. And just for your hopes we have the Casey Commission and a lot of drive and advocacy. It seems to have been the poor cousin and never quite got over the line in terms of being reformed and funded in a way that can be sustainable for the long term.
Yes, I thought it was unfinished business. I only became the Secretary of State for Health and Social Care formally 6 months before I left the job to become Foreign Secretary. And what I feel it needs is both more funding and more reform. And at the moment, the sector is in crisis, and it's not really clear how it's going to get out of that crisis. I think that the number of unfilled vacancies is something like 160,000. It's gone up by 50%. It's about 10% of the entire workforce. I think there are still 3.5 million people a year not getting the care packages that they need. And I saw a survey in Scotland of something like half of care homes are now at risk of closure. So I think there are some really big problems. So when I was Chancellor, I did try and address some of the unfinished business in the autumn statement of 2022, my first fiscal event, when I gave a 38% increase to the social care budget. I think its biggest ever increase historically. It can't just be about money, though. And I think that there are a couple of things that we need to think about. First of all, the Dilnot reforms have now been cancelled by the government. And that means that there is no plan in place to deal with the real unfairness of people who end up with a neurological condition that ends up, cleaning out their entire life savings. And I think that we allowed the social care debates to become something about helping Middle England protect their inheritances if, someone got dementia in their family. And I think that what we need to do is to refocus this onto actually much lower income people who suddenly find that they are losing everything because they've got motor neuron disease or indeed dementia. And that is something where there are people who are very, very unfair in the lottery of life. And, we need some kind of pooled insurance system to address that. But I think the most important thing to recognize is that we won't solve the problems in the NHS unless we solve the problems in social care. In January, 13,500 beds in the NHS, about 100,000 beds, so around 13% of all beds, were occupied by people who could have been discharged.
But weren't able to.
But weren't able to be. The result is that we have a crisis in our A&E departments. There are, according to the Royal College of Emergency Medicine, about 250 excess deaths every week in A&E departments caused by people waiting for a long time on trolleys. And a lot of that could be resolved if people who need to be admitted from A&E could be admitted. So these sectors are totally linked. And I think what we need to do is, at a local level, we need to fully merge the social care and NHS systems so that if you have a vulnerable elderly lady in her 90s with early stages of dementia, she has one health and care budget, and the social care system and the local NHS come together and say, we're going to have one budget for this lady, and how are we going to look after her so that she doesn't get admitted to hospital, because that would be terrible for her, but also very expensive for the system, because once you admit someone like that to hospital, it's very, very hard to discharge them. And that is a big reform which I don't hear anything about from the government. But in the end, at a local level, I don't think you can do it at a national level. At a local level, that is the only way forward.
Well, Baroness Casey, if you're listening, I hope we'll hear the recommendations and findings in 2026. I'd like to end, if I may, to look forward a little bit. Congratulations on your new book, Can We Be Great Again? I think the central, we can't talk about all of it, but particularly around the healthcare aspects, two things that really struck me. But I think the central thesis is, in a dangerous world, Britain needs to find its voice, its advocacy, and to leverage the goodwill and networks and its traditions.
Yes, and I think we've got into this kind of national state of doom and gloom. And part of it is because we've just kind of come through the Brexit wars. And, just under half the country were really annoyed that we left the EU. And the half that voted for Brexit hasn't worked out as well as quickly as they hoped. So you've got two very disappointed groups of people. And I think we've stopped seeing the wood from the trees. And health is a really interesting example, because in the pandemic, vaccines and treatments discovered in the UK saved about 7.5 million lives globally. That's more than vaccines or treatments discovered by any other country. And that is because we have Europe's largest life science sector. We have a thriving university ecosystem with spin-outs, and you can see that scientists in the UK are working on absolutely groundbreaking discoveries. And given that under President Trump, America seems to be cutting back. I think they've cut Harvard's research budget in half. And so there's a really big role for countries like the UK in helping to stop future pandemics. And so I think we need to get our mojo back. And I think the thing we've forgotten is, we have big problems. I don't want to minimize those, but so does everyone else. So does America, so does China, so does France, so does Germany. And the world is a very dangerous place. And my argument in the book is that countries that have influence, and we are one of those, should use that influence.
Absolutely. And on the final point around, you said that medical spending can actually make our country a life sciences giant. And I think the Darcy report really promotes the idea of a nexus. The NHS has got a very big role to play in terms of being a partner to industry.
We do. And, in particular, you've got the UK Biobank, which is probably the world's most valuable resource for genetic information that tells people about how to prevent ill health and how to counteract the effects of aging. It's absolutely revolutionary. And with the NHS, as we saw with dexamethasone, the treatment for COVID that saved 1 million lives globally, that happened because we rolled out a trial in the NHS almost instantly in the early stages of the pandemic. At its best, it's absolutely amazing. Let's not forget that. But let's not work any the less hard trying to deal with some of the problems that we also know exist.
The social contract that the societies are based on is under pressure at the moment. You write in the book that it's important for us as a nation to be proud of the history, that we've contributed to look forward. I wanted to really end maybe perhaps with a contemplation from you about how we can encourage that. People talk a lot about rights. The counterbalance of that is there's responsibilities. Some people are very fortunate. You honour your parents in both your books. I think your father worked in the NHS management, your mother's nurse, inculcating that public service spirit. And you said the NHS should remain a public service. I just want to get your thoughts on a bigger change in society. Getting back our mojo is probably predicated on finding that sense of society and connection.
Absolutely. And, if you look at the UK, I'm going to give you a very future-facing example.
Please.
Now, so at the turn of the 19th, 20th century, you have people like Karl Marx saying that capitalism is unsustainable because it's making a few people really rich and everyone else is working in factories and it's going to implode. And he was proved wrong. And the reason he was proved wrong was actually because in Britain, more than anywhere else, we had a whole series of brilliant social reforms, culminating actually in the setting up of the NHS, but also, saying that children have to go to school, they're not going to send them up factories, Clean Water Acts, Clean Air Acts. We did a whole bunch of reforms which made capitalism work for everyone. Now, it's beginning not to work for everyone. And when we have artificial intelligence destroying lots and lots of jobs, we're going to once again have a system which makes a few people very, very rich and many other people insecure. So why doesn't Britain get out there and work out how do we tap into the massive benefits of technology and AI so that it's something we all benefit from? That's something we could do really well in the UK with our innate sense of public service. And I really hope we do.
On that very hopeful and visionary future-facing note, Jeremy Hunt, thank you very much for your time and your candor today.
My pleasure. Thank you for having me.
If you enjoyed this episode of Voices of Care, please like, follow, or subscribe wherever you receive your podcasts. And if you want to really see how we are changing the debate on health and social care, please visit newcrosshealthcare.com/Voices of Care. In the meantime, I'm Suhail Mirza. Thank you very much for joining us today, and I look forward to seeing you on the next episode. I think that's what we call a wrap.
Voices of Care, the healthcare podcast.